Hey everybody, I'm Michelle from Virtual Hand Care, and in this video I'm going to show you 8 of the best exercises that you can do after your carpal tunnel surgery so that you can quickly get back to using your hand normally again. And actually, these exercises are helpful from a few days post-op to about 4 weeks or longer if you need it. But of course, always check with your doctor before you start exercising. But typically, your goals during the first 4 weeks after either an open carpal tunnel release or an endoscopic carpal tunnel release should be focused on increasing your finger, your thumb, and your wrist range of motion, encouraging light use of your hands with daily activities while keeping your swelling and your pain minimal, but more importantly, not overdoing it so your nerve can heal. Now, with these exercises, you don't need any equipment, and we are going to do 10 repetitions of each. And you'll want to do these about 2 to 3 times a day to keep ahead of that stiffness and the possibility of scarring, so make sure you save this video. Now, the order of exercises is important, so we're going to first start by moving the tendons and the median nerve that's located in your carpal tunnel. And the deepest tendons in your tunnel is all 4 of your FDP tendons. So let's get those moving with exercise 1, and that's DIP blocking to each fingertip. Okay, so to do this exercise, prop up on your elbow, straighten all your fingers. You're gonna use your other hand to block all the other joints of your finger from moving. So we're gonna start with the index finger. So you wanna keep the fingers straight, and you're gonna use the thumb of your other hand and place it right below the tip of your index finger. Now what you wanna do is you want to actively bend the tip of your finger and straighten, and that's 1, down and straight, that's 2, bend, straight, 3, bend, straight, that's 4, down and up, that's 5, down, up, that's 6, down, up, that's 7, down and up, that's 8, bend and straight, 9, and bend and straight, and that's 10. All right, let's move to the middle finger. Ready? And bend and straight, that's 1, and again, that's 2, 3, bend and straight, 4, 5, 6, 7, 8, 9, and 10. Now let's move to that ring finger. Ready? Bend and straighten, that's 1, bend, straighten, 2, 3, 4. If the other fingers move, that's okay. 5, 6, 7, 8, 9, and 10. All right, let's do the tip of the small finger as well. Get that FDP gliding of the small finger. Ready? And bend and straighten. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, and 1 more, and 10. Good job. Okay, exercise 2 is PIP blocking. So this will get all 4 of your FDS tendons gliding. Those are the tendons that bend the middle joints of your fingers. So to do that, same thing, you're gonna go ahead and just move that thumb down, and now you're going to block right below the middle joint of the index finger. To start here, let's do 10 of each as well. Ready? Bend and straighten, that's 1, 2, 3, 4, 5, 6, bend and straighten, 7, 8, 9, and 10. Good job. Now let's go to the middle finger. Keep in mind, if you can't bend all the way down, that's okay. You're just starting out, so just do what you can. All right, bend and straighten. That's 1, down and up. That's 2, 3, 4, down as far as you can and as straight as you can. 5, 6, 7, 8, 9, and 10. Good job. All right, let's go to the ring finger. Let's bend the ring finger FDS as well. Get that gliding through your carpal tunnel. And bend and straighten. That's 1 and 2, 3, 4, and if the other fingers move, that's okay. 5, 6, 7, 8, 9, and 10. Okay, now let's go to that small finger. Ready? Block right below that PIP joint right here and bend and straighten. That's 1, bend and straighten, 2, 3, 4, 5, 6, 7, 8, 9, and last one, and 10. Good job. Now let's focus on your thumb. Exercise 3 is thumb IP blocking. This is going to work the FPL tendon, which also goes through that carpal tunnel space. So to do that, we want to just get the tip of your thumb to bend. You can prop up on your elbow or you can bring your hand down on a table to do this exercise, whatever is comfortable for your thumb right now. Just make sure you're just bending the tip only, okay? So ready? Let's go ahead and pinch right below the crease of that thumb and then bend and straighten as much as you can. That's 1, down and up. That's 2, 3, 4, 5. I'll show you what it looks like resting on the table. Bend and straighten. That's 6. Bend and straighten. 7, 8, 9, and 10. All right, now let's combine all of that together in exercise 4, and that's tendon glides. So to do this exercise, you're gonna go ahead and prop up on your elbow, try to straighten the fingers and the thumb as much as you can. Really feeling a little light pull in the palm, probably throughout the incision there. And then what you want to do is you want to go ahead and bend into what's called a hook fist and make sure that thumb bends as well. You bend as much as you can. And then you want to go ahead and move those fingers down into a full fist. You really don't need to be clenching, just really work on just curling those fingers nice and lightly into your palm. And then go back up to that hook and straighten. All right, let's go ahead and do 10 of those. Ready? So straighten up, hook, gentle fist, hook and straighten. That's 1, hook, fist, hook, straighten. 2, hook, gentle fist, hook, straighten, that's 3, hook, fist, hook, and straighten, that's 4, hook, fist, hook, and straighten, that's 5, you're halfway there, hook, to a gentle fist, back up to hook, and straighten, 6, hook, fist, hook, straighten, 7, hook, making sure all the fingers are bending and the thumb, gentle fist, back up to hook, and straighten, that's 8, let's do 2 more, hook, fist, hook, straighten all the way, that's 9, 1 more, hook, fist, hook, and straighten up and spread those fingers a little bit too there. And that's 10. Okay, now we are going to get some other muscles and tendons moving, even ones not located in the carpal tunnel, but are still very important to move to prevent stiffness and scar adhesions from your incision. So exercise 5 is called MP blocking. This actually works the lumbrical muscles in your hand. So to get these moving, you want to bend your large knuckles down and then straighten all the way up. Let's do 10 of those. Ready? So go ahead and bend those large knuckles, only trying to keep the other fingers straight. Also try to keep the wrist straight. Even back just a little bit is okay. You can place your other hand in your palm just to kind of help that. And straighten all the way up. And that's 1. And come back down. And straighten 2. Bend and straighten 3. 4. 5. 6. Flex those large knuckles only and straighten up as much as you can. 7. Down and up. That's 8. Down and up. That's 9. And that's 10. Good job. Exercise 6 is thumb O's. This works on thumb range of motion and differential gliding, which basically means each finger tendon gets to move by itself. So let's start by making an O with the thumb and the index finger. And then you want to go ahead and straighten all the way up. So that's 1. Touch the tip of the finger to the tip of the thumb, making an O, and back up. That's 2, 3, 4, 5, 6. Make sure you open all the way back up, and then touch the tip to tip there. That's 7, 8, 9. Let's do one more. And 10. All right, to the middle finger. Ready? Try to make an O. Tip a middle finger to tip a thumb. Making a circle there. Making an O. And open. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. Now tip of the ring finger to tip of the thumb. Again, trying to still make that O. And open. That's 1, 2, 3, 4. Doing these just nice and slowly and gently. 5, 6, 7, 8, 9, and 10. Now let's do that small finger. Tip of the small finger to tip of the thumb. And open, that's 1. And if that's really straining the thumb and you can't touch all the way because that is very painful, it's okay, just do what you can. Eventually you will be able to touch the tip of that small finger. 2, 3, 4, 5, 6, 7, 8, 9, and one more, and 10. Good job. All right, and now let's get your wrist moving with exercise number 7, and that's wrist flexion and extension. But it's important to make sure that you start with just a short arc of motion and then increase to a full range of motion over the next several weeks. All right, so let's go ahead and just relax your fingers so that you can really just focus on moving that wrist. So let's go back into as much wrist extension as what you can do. Again, you don't have to go too far with this. And then you want to go ahead and just relax those fingers and then just gently bend that wrist forward into flexion. And then come back to neutral. And that's 1. So go ahead and go back into extension, forward into flexion, and back to neutral. That's 2. Nice and slowly back and forth and back to a neutral position. That's 3. That's 4. Just a nice short arc of motion here within a comfortable range. Back to neutral, that's 5. Back in extension and forward into flexion. And to neutral, that's 6. Back and forth to neutral, that's 7. And back and extension, forward into some flexion, making sure those fingers are relaxed, and back to neutral, and that's 8. And if you can go a little bit farther, that's wonderful. Do what you can. And forward. Forward might be a little more sore just because you're kind of pinching on that incision a little bit. And back to neutral, that's 9. And back in extension. And forward in flexion. And back to neutral, and that's 10. And now our last exercise, number 8, is median nerve glides. Now this exercise will be a little different than the ones that you just did because we are going to be specifically targeting your median nerve. But since your nerve was compressed, which is why you had it released, and it's still healing, you want to do these exercises very gently and slowly. And so to do this exercise, you're going to place your arm straight down by your side. Wrist and forearm are in a neutral position. Fingers are slightly spread apart, and then you want to tilt your head towards your shoulder. This will slack your nerve. But if you move your head in the opposite direction towards your other shoulder, this will actually tension the nerve, which in my opinion puts excess tension on your nerve. So I can't emphasize enough not overstretching your nerve that you just had surgery on. So make sure these glides do not cause any pain or more tingling. So again, tilt your neck towards your shoulder, spread those fingers. Next, what you want to do is try to extend the wrist just a little bit. So we just warmed up that wrist, right? So you want to go ahead and bring that wrist back into a little bit of extension. And then what you want to do is we're going to hold this position here for 5 seconds. So 1, 2, 3, 4, 5. And relax. Now, because we are working on the nerve, we're just going to do 5 repetitions total of this. So again, straighten those fingers, bring the wrist back, bring the head over. 1, 2, 3, 4, 5, and relax, and that's 2. Again, bring the wrist back, fingers open, just to what you can do. Head over to slack that nerve a little bit. 1, 2, 3, 4, 5, and relax, that's 3. And again, 1, 2, 3, 4, 5, and relax, that's 4. And let's do one more. Extend those fingers, extend the wrist just a little bit, bring the head over. 1, and hold. 1, 2, 3, 4, 5, and relax, and that's 5. Now, over the next several weeks, what you might find you can do is bring those fingers a little bit farther away from your body, extend that wrist a little more, and eventually even bringing the arm away from the side. However, you only progress if that feels good and you do not have any kind of increased pain or tingling in your nerve. Now, as I mentioned before, make sure you do these exercises a few times a day until you feel like you have achieved pain-free range of motion. Now, if you found this video helpful, do please give it a like and hit that subscribe button below. Now, if you're not sure what to expect 1 week after your carpal tunnel surgery, or if you're feeling uncertain about how you should be feeling, then check out my video, What to Expect 1 Week After Carpal Tunnel Surgery. It's here that I talk about postoperative dressings, incision care, pain and swelling, movement and function, and understanding your limitations after your carpal tunnel release. You'll gain clarity on what to expect during your first week of recovery, so make sure to check that out. Until next time, thanks for watching.